Thank you for the opportunity to present today, and in particular to represent an application in psychiatry and in mental health in affiliation with the New York State Psychiatric Institute. So I'm going to first discuss what is first episode psychosis, and then what is coordinated specialty care as a treatment for first episode psychosis, particularly On Track in New York is the program that we'll focus on. And then how it participates in a learning healthcare system and how data science can be used here. So what is first episode psychosis? Well, psychosis is a condition of the mind that affects about 1% of the population, where there's been some loss of contact with reality. Symptoms include false beliefs, hallucinations, seeing or hearing things that others do not. When someone becomes ill in this way for the first time, they're said to have had a psychotic episode. And a first episode of psychosis most commonly occurs between the ages of 15 and 30 years old. And what we've learned is that identifying an adolescent or young adult with a psychotic disorder early, soon after a first episode, and connecting them with care can lead to better outcomes. The NIMH initiated a program to build an evidence base for this early intervention called the RAISE project back in 2008. And they showed that coordinated specialty care actually works. It is able to improve functioning, social functioning, occupational functioning of individuals if they are intervened upon early. So what is coordinated specialty care? Well, it's a wraparound service that includes not only evidence-based psychopharmacology, but as well as psychotherapy, and then case management, including peers and connecting to others who have had similar life experience, supportive education and jobs, as well as family support. So it's a multi-component approach to an intervention. My colleague, Lisa Dixon, who a psychiatrist, has worked very hard within the state of New York, as well as broadly across the country, on trying to work on the implementation of this type of coordinated specialty care into practice. Working with government leaders here in New York, in the Office of Mental Health, we were able to create, within the last 5 years, the On Track New York system, which is basically an implementation of coordinated specialty care across the state for people who have experienced the first episode of psychosis. Currently, there are 21 sites across the state, including 15 here in the New York City area. And so what is On Track? Well, On Track is an implementation of coordinated specialty care, and it enrolls about 500 individuals across the state each year. And sites are contractually obligated to participate in data collection and continuous quality improvement in order to be considered a site and receive block grants to participate. And so from its inception, it is focused on utilizing data to help inform the care. And so the data is collected in the pathway to care prior to the first episode, and then many client characteristics at intake, including their medical and psychiatric histories. And then during the care itself, there is a sort of feedback loop between information collected on the treatment processes themselves and their fidelity, as well as monitoring of patient outcomes as they are utilizing those services. And then after approximately 2 years, a person is discharged from the program, and then there's a data system being built to sort of monitor how people do once they leave the program. And that concept really falls within the idea of a learning health system, which really is merging the delivery of care with data science and quality improvement processes. And, at the core, it really begins and ends with the clinician-patient interaction. And so what can data science do here? Well, because data is being collected and wrangled at each step, we were successful in getting a research grant to look at how we can take all that data and really do a good job of creating a true learning health system rather than just conceptual learning health system. And so some of the first steps were to use machine learning predictions for data-driven decision-making between the clinician and the client, as well as considering different data visualization methods to share that information to the clinician as well as the client for shared decision-making. On the left side of this slide is how we have sort of more traditionally thought about utilizing the data that's been collected from this system, which is looking at things at the group level. And so the plot on the upper left, I'm showing you 3 different functioning measures, and the x-axis is time with baseline and then every quarter afterwards for patients in the program. And, in general, the population is increasing in terms of their functioning. But that's an average over, over 1,000 people. And in the bottom left, the white increasing one is being in education or school, and then the decreasing line is inpatient hospitalizations, which of course we want to see go down. But the goal now is to really not just predict for the whole group, but for individuals. So we've done that utilizing the large number of variables that are collected on patients at intake as well as across time. And there's over 200 administrative data variables that are collected. And utilizing those, we've created a prediction model of, in this case, this test case of whether they'll be in work or school at 1 year. And without going into the details too much, it was able to, have good performance in holdout samples. And we've started to use that for particular patients where, given an information of whether the person is working or not at baseline, how they're going to be doing across the different quarters for a year out. And here I'm showing for another client. But what has been very interesting is to see our interaction of showing those results to the clinical teams. And initial questions, how good should these predictions be before the clinician decides to make a new decision based on them? And I think this is a very important question we need to address going forward. And what's the best visualizations for that patient-client interaction? I'll just end with the fact that, when we went into this project, we sort of expected to spend a lot of time in the yellow, which is building an optimized machine learning prediction algorithm, and didn't think so much that we would be spending most of our time on building the infrastructure to collect the data, cleaning the data, which is the orange and the gray. And then now we're really realizing that the reality is we need to spend a lot more time on the deployment of these tools and making sure they work in a equitable way and a way that will help improve people's lives. Thank you.